Hey everyone, this is Dr. Rabenak. Welcome to Psychiatric Pharmacy. This is just a brief welcome message to kind of orient you to the course and what to expect. If we were meeting in person, our class would start this Wednesday at 12:30. So I'm going to kind of follow a similar schedule, even though we're not meeting in person. Most of this class is asynchronous, meaning that we don't have a specific time that we get together as a group. What instead I'll be doing is every week at 12:30 on Wednesday, I'll be releasing material for that week that you're responsible for reviewing and an activity that goes with that or a discussion board. You will have until Tuesday, 11:59 p.m. to submit any assigned work or any discussion boards. And then I will release the next week's material on Wednesday at 12:30 p.m. So it's going to be released on a week-by-week basis so that we all stay on the same page. This class is not lecture-based. It's a very interactive discussion, and even though we're not in person, we've come up with some ways to try to enhance the ability for us to discuss. So one of the major ways we do that is by utilizing discussion boards. So a lot of the topics that we will be talking about will include discussion boards where I will post some questions to you and you will need to provide an answer or response, and you will also be asked to respond to at least two classmates' comments. Okay? But a couple things I encourage you to do. Please don't wait until the last minute, Tuesday, 11 o'clock at night, to attempt your discussion boards. That's not going to give you a lot of time to come up with something thoughtful or be able to comment on other people. If everyone in the class does that, then you guys are going to be scrambling to not only write your own post, but respond to each other. So please try to post your responses early so that you can then allow people to comment on yours and you have time to comment on other people. Although I say I want you to respond to at least two classmates, I do encourage discussion back and forth. So please be checking that you'll get notifications if you have that turned on in Canvas when somebody responds to your discussion post. Please be checking that and going in because somebody might pose a question to you. And so feel free to carry that dialogue back and forth. That's going to be most effective if you do your discussion boards early on in the week than waiting till the last minute. Your grading is going to be more based on your participation and interaction with your classmates and your engagement with the material for the course. There is no necessarily right or wrong answer. Psychiatry and psychiatric treatment tends to be a very gray area where there's a lot of variability in how we might treat patients, and there isn't necessarily clear-cut guidelines that work for everyone. Okay? So with that being said, I'm not grading you on whether your response is right or wrong. I'm grading you on how specific and detailed you are, your justification for if I ask you to defend a particular position or an argument, your justification for that, and then your engagement with your classmates, so your types of responses that you're saying. So when I say responding to somebody's discussion post, something more than, hey, Christine, I think that's really cool idea. I agree with you. I want to know a little bit more. What exactly do you agree with? And why do you agree with them? And what are your thoughts on that? So kind of expand it a little bit. These responses don't need to be long, okay? But they do need to have some sort of substance to them. And I'll be giving feedback on, weekly on your discussion posts individually, whether or not you need to increase your engagement or you're doing a good job, keep on track, keep doing what you're doing. So I will help you with that in giving you some feedback, all right? There will be 2 live sessions in this class that everyone is required to attend. The first one is on May 28th at 12:30. We have a guest, Patty Dixon, who is a CAPS counselor that will be giving a presentation and leading discussion for our class. I've booked 2 hours of time. We'll be meeting through Zoom, and we may not use that full time, but I want to make sure if anybody has questions, they have enough time to be able to ask those and nobody's getting cut off. The second one is on Friday, June 11th, and that one is also at 12:30 p.m. and it is going to be a panel of psychiatric pharmacists. And so this panel will be a discussion on their role in psychiatric pharmacy, their experiences, how they got there, challenges they face, and kind of their treatment of different psychiatric conditions, things they've learned, things they thought they knew that might have changed their opinion about, and so forth. So we're going to have a discussion with those people as well. So those are mandatory. Put them on your calendar now. Otherwise, everything else is asynchronous. If you have any questions throughout the course, I've created a discussion board called General Course Questions. Please post your question there. Your classmates might have a similar question and could benefit from seeing the results or the answers. Or you can email me too. Okay, I try to respond within 24 hours. And then if you also go to the website, you can view the syllabus. You can also view another discussion thread that talks about kind of ground rules for discussion boards. And this I'm not really concerned so much about, but it is about professionalism and respect for other people's opinions, differing opinions, how, it's okay to have differing ideas or not agree with someone and to have a discussion about that disagreement, but there's a right and wrong way to go about that. That is really professional or not professional, okay? And so it kind of talks about that, gives some examples. I'm not worried about that, but I want to make sure that I've covered it. And if there are any issues, I will address it privately with that individual. Okay? All right. So every week at 12:30 on Wednesday, I'll be releasing the material for that week with the assignment. With that will be one of these videos that I will record and tell you about what to expect for that week and summarize or give some feedback or general thoughts and reflection on your responses or work from the week before. Okay? If you have anything that you want to share with the class, a personal experience with mental health, whether it be yourself or somebody else that you think is relevant to the discussion and you feel comfortable sharing that, I encourage you to do so. Nobody is required to do that. And if somebody does disclose something personal, I ask that we keep that within this class and within our group. Okay, and we don't share that outside of this class. All right. Sometimes discussion of these topics can be distressing to people, especially if they are going through something similar, have gone through something similar, or know somebody that is. So if that is the case, please feel free to reach out to me. I'm happy to talk to you about it. Again, I don't want anyone to feel uncomfortable about this. It's difficult topics sometimes, so please reach out. Then lastly with this course, it's not going to be about going over DSM-5 criteria for different conditions or how to read a treatment algorithm or the guidelines for something. It's going to be very different than that. We are going to talk about why treatments work and this for one person but not for another. Research that is trying to come up with unique strategies to help in the treatment of psychiatric conditions. Considerations. A lot of people with let's say they have post-traumatic stress disorder. They've been diagnosed. They might also have generalized anxiety disorder, major depressive disorder. They might have substance use disorder. They could have a lot of different comorbidities that go with that diagnosis. And so it's not necessarily somebody just has one thing that they meet criteria for. Okay. And we'll also be talking about that as well as what are the limitations of the DSM-5 criteria, right? They are just that. Not everybody meets all of those criteria to qualify for a diagnosis of that condition, but even if they don't, it doesn't mean that they aren't struggling or that their symptoms aren't debilitating to them. So we're going to talk about that as well, okay? So again, I look forward to working with you this semester. If you have any questions, feel free to post it on the general questions about the course discussion thread or email me and I will get back to you again within 24 hours. So stay tuned because this Wednesday at 12:30, I will be releasing week one's materials with the intro message for week one. All right, take care. Talk to you soon.